Warm compresses are amazing at treating Meibomian gland dysfunction for dry eyes, blepharitis, or even styes. At the same time, the heat can cause inflammation on the eyelids or may even contribute to a change in your corneal shape. So this video is going to be the ultimate guide at how to do warm compresses safely and effectively. Let's focus in. Hey, howdy everybody, this is Dr. Neil Guymon, Dr. EyeGuy, committed to helping you with your eyes. Now for this video, make sure you check the description below for any helpful links, as well as links to the different warm compresses I'll show in this video. This is also a two-part series video, with the second video being on how to do eyelid massages safely and effectively. But for this video, let's focus on warm compresses. Now the benefits of warm compresses is that it allows you to treat the Meibomian glands of the eyelid. You have oil glands that run vertical top and bottom eyelids, and sometimes the oil in those oil glands can get hard and thick and sometimes clog up the oil glands and may contribute to dry eyes or blepharitis or even styes. And the warm compress treats those oil glands, it liquefies the oil so it can get out easier. Now the challenge here is you want to provide the right amount of heat to the eyelids to treat the oil glands, but also not go too hot because you might scald or burn the skin of the eyelids, or you might also cause inflammation, which would be counterproductive of what you're trying to do. Now another challenge of warm compresses is the heat can actually heat the cornea of the eyeball. And if you apply heat to the cornea, it becomes a little bit more flexible, a little bit more malleable. So if you apply pressure to that heated up cornea, it can actually change or warp the structure or the shape of the cornea. And this becomes an extra worry when you start doing eyelid massages. If you push and bend on that cornea, you might be contributing to a warpage of that cornea. It might contribute to something called keratoconus, which is a corneal condition. So let's go over the safe and effective way to do warm compresses and also what warm compresses I recommend. Now you want that perfect constant heat to the eyelids, and a lot of people will try that washcloth method where you warm it up in warm water, put it on the eyelids, but it gets cold really fast and it's not that effective at heating the oil glands of the eyelids. It's worth it to invest into a specific warm compress like this. This is the Hydrate warm compress that you can pick up at ilovethesun.com or Amazon. Again, I'll put the links below. Very good at retaining its heat and providing that perfect constant temperature to the eyelids. And it's really easy to use. The first thing you'll do is put it on a plate and put it in the microwave for about 15 to 20 seconds. I found that 15 seconds works the best for me. Take it out of the microwave, and to test the temperature, put it on the inside of your wrist to make sure it's not too hot. It's not going to scald or burn your eyelids. Now the eye mask has a strap, so you strap it on, place it right over your eyelids, and let the mask do the work. Now some studies have tried to find out what's the magic amount of time to do a warm compress. With the right temperature of warm compress, the magic number was 6 minutes. It took 6 minutes to change the temperature of the eyelid enough to treat the oil glands. Now I try and shoot for 10 minutes. Some people can even do it longer than that or even make the masks hotter. But you want to be careful here, because if you go too long or too hot, it can cause inflammation, make your eyelids red, and can be counterproductive of what you're trying to do. So you want to try and find the perfect balance for you. When you're done with the warm compresses, you can take it off and follow the cleaning instructions that come with these masks. Again, these masks are great, highly recommended. Another common one is brooder masks. Again, I'll put the link in the description below. Another popular form of warm compresses are the electric heat masks. Very convenient. You just plug in the heat mask, set it to a specific temperature that you want, apply it to the eyelids, and it will stay that constant temperature the whole time that you're doing the warm compresses. Super convenient, might be a little trickier to keep clean, but still highly recommended. Now both of these warm compresses are great and amazing. Both of them also put a little bit of pressure onto the eyelids and the cornea. And you might notice this when you're done doing the warm compresses. You'll notice that your vision might be a little bit blurry. And this might be for two reasons. One, because you heated up the oil in the oil glands, more oil might be in the tear film causing the blurry vision. And two, and the more likely one, at least for me, is that it changes the shape of your cornea. Now you'll notice if you have blurry vision, it'll come back pretty quickly. That's because the cornea does snap back to its original shape pretty fast. Now the worry about this came from a study that showed people using eggs for warm compresses. That heat from the egg and the hard surface and that bend of the egg was pushing onto the cornea and caused some changes to their corneal shape. And more of the worry comes from doing eyelid massages right after you do warm compresses. Now, if you just wanted to be extra safe, just to avoid any possibility of reshaping your cornea, there are a few things that you can do. With these warm compresses that I mentioned in the video, try not to do them while you're lying down. That extra gravity could push on the eyelid and the cornea a little bit more, so try and do the warm compresses while you're sitting up. And if you want to be extra safe, there's another great warm compress option, and that would be to use kind of a revolutionary style of warm compress by Tear Restore. Now, what's nice about the Tear Restore mask is that it comes with a heat pack where you activate it by pushing the little medical disc in there, causes a chemical reaction, and you get heat from the pack almost immediately, and then you put that inside the mask. And what's nice about this is that you can actually keep your eyes open while you're doing the warm compress treatment. So you can keep your eyes open, you can actually blink, which is a little bit added benefit to the effectiveness of the treatment. But the big thing is that you're not putting any extra pressure onto your eyelids or your cornea. And so if you wanted to do this and just avoid any pressure or corneal reshaping that's possible, this is the way to go. And studies have shown that even with your eyes open, it still applies that perfect constant heat to the eyelids to make it very effective. And on top of that, if you do want to lie down while you're doing your warm compresses and you want to avoid other warm compresses that might push on your cornea, then this is the way to go for that as well. You can put this on, lie down, close your eyes, and still get that effective treatment without the extra pressure on your cornea. Now, how often should you be doing these warm compresses? This is also different from person to person depending on what you're trying to treat. Now, if you're trying to maintain or treat dry eyes, you want to at least do it once a day, twice if you can. Same thing with blepharitis. Try and do it at least once a day. If you're trying to treat styes, you want to try and do it at least 3 times a day, more if you can. And this is where you want to work closely with your eye doctor depending on the condition that you're treating to know exactly how long or how often you should be doing these warm compresses. Now, one thing to note that's helpful for a lot of people that are dealing with blepharitis or rosacea or inflammation is that they'll do the warm compresses and eyelid massages, and then right after they'll do a cold compress to bring down the heat and maybe reduce the amount of inflammation they might get from the warm compresses. Now that you know the best way to do warm compresses safely and effectively, it's time to check out part 2, where you'll learn how to do eyelid massages safely and effectively. I'm Dr. Neil Guymon, Dr. EyeGuy. Thanks for watching. Stay focused. Check out part 2 or one of my other videos, and I'll see you in the next video.